The Ministry of Health, through the National AIDS Secretariat, held a press conference on Friday at 8 Scarab Avenue headquarters in preparation for the 2024 World AIDS Day commemoration. The press conference aimed to update the public on the upcoming World AIDS Day commemoration on December 1st, 2024. The theme for this year's observance, Take the Right Path, My Health, My Right, underscores the importance of ensuring that everyone, everywhere has the right to access quality healthcare services in fight against HIV and AIDS. According to the UN AIDS report, the global goal of ending AIDS as a public health threat by 2030 remains achievable, but it requires world leaders to protect the human rights of those living with or at risk of HIV. An official from the National AIDS Secretariat emphasized that while there is no cure for HIV, access to effective prevention, diagnosis, treatment, and care, especially for opportunistic infections, has transformed HIV into a manageable chronic condition. This has enabled people living with HIV to lead long and healthier lives. Speaking to journalists, the director of the National AIDS Secretariat, Alpha Khan, stressed that this year's campaign, led by the World Health Organization, calls on global leaders and citizens to advocate for the right to health by addressing the inequalities that hinder progress in ending AIDS. He further noted that achieving this goal requires prioritizing and reaching all individuals living with or affected by HIV, including key population such as men who have sex with men, transgender individuals, people who inject drugs, sex workers, and incarcerated people.
Everyone should have access to the health service they need. That's the rights I was just talking about, including HIV prevention, treatment, care, and service, when and where the need arises. Protecting the right to health means ensuring that healthcare is available to everyone without any discrimination, regardless of their HIV status, background, gender, or wherever they live. Though progress has been made, but then there are challenges. Among these challenges, stigma and discrimination. People living with or at risk for or affected by HIV often experience double burden of the disease itself and the stigma around it. Challenging stigma and discrimination as well as protecting everyone's human rights.
HIV remains a major global public health issue, having claimed an estimated 42.3 million lives to date. Of the 39.9 million people living with HIV worldwide, 65% are in the African region. The National AIDS Control Program Officer of the Ministry of Health, Pa Usman Ba, highlighted that 9.3 million people are still not accessing life-saving treatment. He also reported that in the past years, 630,000 people died from AIDS-related illnesses. Mr. Ba then shared the following statistic on AIDS in the Gambia.
We did a national sentinel surveillance among pregnant women in 12 sites across the country. And the prevalence, although it's relatively low still, but the prevalence showed in 2023, 1.3% of our population are HIV positive. This study is done among antenatal women. And for antenatal women, they are representative of the general population, because if we had any pregnancy, there must be a male partner. So you can say 1.3%, which equates to almost over 26,000 people living with HIV and AIDS in the country. We've also seen some differences between prevalence in regions. And in one of the sites, like Basse, URR, having the highest prevalence, followed by Bansang and Brikama.
He also provided key statistics on the state of HIV in the Gambia, noting that in 2023, approximately 60% of the 26,000 people living with HIV in the country had been diagnosed, marking progress towards the first of the 395 targets set by UN AIDS.
Identify people who have HIV, not those who are tested, but those who are HIV positive. We should be able to identify 95% of them, but we were able to achieve 60%. And for the second 95, which is actually putting those people who have already been identified, put 95% of them on treatment, we were able to achieve 65%. And for the third 95, which is talking about those who are put on treatment should be virally suppressed. For instance, when we say virally suppressed, we are talking about when they have a viral load that is undetectable. I know some of you might be can remember during those days undetectable level. So that's the time you say you are virally suppressed. And with the treatment that we have currently, if you are on it and you adhere to it, within 6 months you are virally suppressed. So if you put people on treatment, they should be virally suppressed. But what we were able to achieve was 61%. So in all these 395 that we are talking about, we were unable to actually meet the target.
According to the World Health Organization, HIV is caused by a virus that spread through various means, including sexual contact, sharing needles for drug use, and exposed to infected blood. It can also be transmitted from parent to child during pregnancy, childbirth, or breastfeeding. HIV attacks and destroys white blood cells, known as CD4 T cells, weaken the immune system. Mam Kumbandaw, the HIV and AIDS project manager at 1.3 of Gambia, highlighted that inability to achieve the first 95 target, a critical step towards attaining the second and third targets, stemmed from insufficient focus on populations at high risk of contracting the virus.
We all know how we get HIV, we all know how we can prevent HIV. But when it comes to accessing people for testing, that is a problem. And I know PAOS has also shared the country data, but I just wanted to share the country data on the key populations that we have. We know if you look at sex workers, and we look at the IBBS that was completed in 2023, we know the prevalence among sex workers is 14% as compared to 1.3% in the general population. And we know for other vulnerable populations, the prevalence is 26%, where you have only, as compared to the 1.3%. So we have 14% in a group and we have 26% in another group. And I think these are populations that we should be looking at if we want to get our first 95, because this is data, and it's telling us that's where you can get your first 95.
UNAIDS Country Director Sira Horajandaw stressed the importance of gender inequality in combating HIV and AIDS, describing it as a cornerstone of human rights-based approach to addressing the epidemic.
Every day in 2023, 570 young women and girls aged between 15 and 24 acquired HIV. In at least 22 countries in Africa, women and girls of this age group are 3 times more likely to be living with HIV than their male peers. According to the Executive Director of UNAIDS, human rights violations are still preventing the world from ending AIDS. When girls are denied education and information, when there is impunity for gender-based violence, when people can be arrested for who they are, when a visit to health services is dangerous for people because of the community they are from, the result is that people are blocked from being able to access HIV services that are essential to save their lives and to end the AIDS epidemic.
Ministry of Health officials underscores the significance of World AIDS Day as an opportunity to reflect on progress made, raise awareness about persistent challenges, and rally stakeholders to intensify efforts towards ending AIDS by 2030. The commemorations serve as a global reminder to the ongoing fight against HIV-related stigma, a tribute to those who have lost their lives to the disease, and a call to action to ensure a future where HIV is no longer a public health threat. Reporting for Kerfatu, I am Ramatulai Jao.